Good morning. Okay, today is Saturday. Okay, before that, let's do a little sound check. Testing, testing, testing. Let me see. Testing. Yes, I can hear everything. Yes, I can hear everything. Okay, perfect. So, this is our regular yoga therapy class. Again, good morning. Today is Saturday, August 12, 2023. This is our regular Saturday yoga therapy class. As you all know, it used to be in person before, and after pandemic it became all virtual. We're discussing yoga therapy for different ailments, different diseases, and we are primarily picking up your requests. So today's request is your IBS, or what is called Irritable Bowel Syndrome. Very important condition for which yoga therapy is extremely effective, because irritable bowel syndrome in our modern medical science is a functional disorder. Also we call dysautonomia. That means autonomic nervous system is in imbalance. Our gastrointestinal system is supplied by parasympathetic nerve. When we have a high level of sympathetic tone, primarily from stress, you develop symptoms of irritable bowel syndrome. And in the modern medicine, practically we really do not have any therapy for irritable bowel syndrome. And when you go to or read about it, you will find multiple therapies which will come and talk. But one of the most effective what we used is that using a bulk laxative called your what is the Physilam, what is over the counter? Oh, like a Metamucil, which you take with less water. So when it inside the intestine, it draws the water from the intestine, it expands its size and moves slowly to the whole gastrointestinal system. Now the symptoms of irritable bowel syndrome, once you have it, you won't forget about it. It is an attack. Suddenly you will have a severe abdominal cramp, a pain, with an urge for a bowel movement, and when you have a elimination, there is an explosive bowel movement, like you've got a lot of your gas will pass, and lot of liquidy and mucus related stool, and it's not too much. Since it is a functional disorder, the symptom varies. But our experience is when there is an attack of irritable bowel syndrome, which most of us had, and me being a surgeon, I had it for a long, long time, but now with my regular practice of yoga, obviously, I've overcome it, that during the attack, if you wear a health tracker, this is an Apple Watch, if you're in a health tracker, you will see your pulse rate probably is 120, 130. You will see all the activities of sympathetic overdrive. So the therapy will be primarily activation of parasympathetic tone, which is the practice of yoga therapy. Why the irritable bowel syndrome is so important is that in the gastrointestinal tract, which Ayurveda and yoga believes to be the most important organ of our body, because the food, when properly digested, the digestion of the food is entirely different in yoga and Ayurveda than our modern medicine. Here, the food we consume is called the 7 coloring fruits and vegetables, like the 7 colors of the rainbows, with the 6 taste: astringent, bitter, pungent, salty, sour, sweet, and it is consumed with your 5 senses. 5 senses are in the mind, so quieting down the mind. When food is properly digested, it converts into body tissues called dhatus, 7 dhatus, and the final product is called your ojas, which is our immune system or immunity. Irritable bowel syndrome is the outcome of our lifestyle, our day-to-day lifestyle, and it is called lifestyle-related disease. And the manifestation, or what you call symptom complex, is a very wide spectrum variant. In the gastrointestinal system, we call it that there are 3 basic organic diseases. Organic diseases means that inflammation of the gastrointestinal tract, like ulcerative colitis, Crohn's disease, inflammatory bowel disease, as many a time we call it, is also autoimmune disease. Ulcer disease, peptic ulcer disease, esophageal ulcer. Ulceration means the breach in the continuity of the mucous membrane. And third is your a tumor, a polyp, benign, malignant, or a malignancy. Rest of all the disorders you look about, gastroesophageal reflux, irritable bowel syndrome, you call it a gluten sensitivity, celiac disease, and we try to find a cause for it, but essentially we end up with what is called a functional disorder or dysautonomia. So the therapy will start first, as all of you know, is the massaging the abdomen, because this is where the problem is. And second, when you look at a yogic lifestyle, the health is defined as a strong digestion, easy elimination, and good night's sleep. There are 5 asanas which I will demonstrate to improve your digestion, which we call igniting our digestive fire. igniting our Jatharagni. Then proper elimination, there is also 5 asanas I'll demonstrate. Then we'll be showing you how to have a proper good night's sleep. The therapy also includes a daily routine. You wake up in the morning, we sit down, drink a glass of water, has a proper bowel movement in the morning. You do the tongue scraping, you do a jalneti, washing. Jalneti is done daily. Then also there are some kriyas called vaman dhoti. Vaman is basically a vomiting. Dhoti means washing your stomach. And remember, these are a completely relaxation response. When you keep on drinking the glass of water, 4 glasses, 6 glasses, stomach is full, you put your hand in the soft palate and the water comes out, and it is called a kunjal kriya. Kunjal means elephant. The water comes out as if it is totally relaxed. A lot of my gastrointestinal friends say, it can cause your retching, it can cause a mallory-wise tear, like a tear in the gastroesophageal junction, there could be a bleeding. But I said it is not the tightness, it's the relaxation. You get a Kapalbhati pranayama. Kapalbhati actually, when you do very rapidly, it's a kriya, and also nauli. Asanas, one of the primary asanas is called a Vajrasana, your thunderbolt. And as we all know, Vajrasana is a very relaxing. Vajrasana is an activation of parasympathetic tone, and it is the only asana we practice after a full meal. Because all the asana we practice in empty stomach, and here the Vajrasana can be done in a full stomach, and most of the yogis do after a main meal, in the lunch, that they will sit down in Vajrasana for some time. In empty stomach is a Mundukasana, is a frog pose, massaging your stomach, and your pranayama is a very absolutely important, is a extending exhalation, which is your parasympathetic tone, and then your slow Kapalbhati pranayama. Kapalbhati pranayama massages all the internal organs, and it also ignites your Agni. It is called Agni Pradhan pranayama. So it ignites the digestive fire. The bandhas or breath holding and exhalation called abdominal lock, Uddiyani bandh, that you breathe out completely, suck your stomach in and hold. Then when you massage the abdominal wall, it is called a Agni Sarkriya. Very, very important. So, when we have a person with a irritable bowel syndrome, first we say, why don't you start with a yogic daily routine? And if you want to go, please go to my YouTube channel, or you can go to my Facebook. There is somewhere you will find the practices for daily routine. But most important practice is called Ushapan. Ushapan means you're drinking water first thing in the morning. And you have seen me doing it quite often. Let me go ahead and show it to you that what we do, Ushapan, we get up in the morning and we'll be so you sit in the Malasana. You sit in the Malasana, and sitting in the Malasana, you will have a glass of water, which generally we keep it on our bedside, and we drink comfortable amount, could be 1 glass or 2 glass. Then sitting here, relaxation. Relax your hands. See, when the hands are relaxed, all the fingers get separated. The wrists are relaxed in extension. This is the tightness. When hand is relaxed, you can do, all the fingers will go in and out without any issue. Put your elbows inside. Keep your spine straight, eyes closed. Sit down for a very short time, and with the practice, you'll still get a urge for a bowel movement. You'll go to the commode and sit down in almost at this position with a gadget called squatty potty. If you have not seen, I have shown you many times. You can go to my daily routine, Dinocharya tapes, and you will be able to see what is the squatty potty. Jalneti, washing your nose, is very important. And then, the most important thing about our daily routine is the lunch is the main meal, and our meal consists of 7 coloring fruits and vegetables, and with a food with a 6 taste. Try not to eat any fruits with the main meal, because fruit has an enzyme which causes interfere of absorption of the trace elements called intestinal glycoprotein, and also interferes with the metabolism of many medication, and that is called cytochrome P450. We eat fruits again, it is 7 coloring fruits, and the coloring is totally based on rainbow, vibgyor, violet, indigo, blue, green, yellow, orange, red. Very light dinner, 2 to 3 hours before going to bed, and a glass of water before going to bed. Very simple. And in the meantime, in the morning, your empty stomach, you do 1 hour of yoga practice, 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. So for the activation of parasympathetic tone, you primarily practice is a pranayama, which is longer exhalation than inhalation. Exhalation is parasympathetic, inhalation is sympathetic. And I know a lot of physicians who has a serious irritable bowel syndrome because of their underlying job. Some of them are surgeons, they're intervention cardiologists, and when they get attacked, it is so serious, so bad, they even end up in the emergency. So the first asana we talk about is your Vajrasana. Vajrasana is, remember, we said, one of the most relaxing of the asanas, and thunderbolt, and this is the one asana you can do after your meal. So sit down. I'm sitting in a malasana. From here, you can start with your sitting on your heel slowly, then slowly keep your spine straight, look straight, and able to sit down. Slowly flatten your feet and able to sit down on your both feet. If you have an issue, generally at the beginning, say you can do in stages. Either you can put a little roll under your ankle or put a little small. I generally prefer a folded blanket because soon you'll develop a neuroplasticity, so you'll be able to unroll that blanket. Otherwise, you can put a very small pillow, keep your spine straight, and then after a meal, you also can do called a right nostril breathing. Right nostril breathing is called Suravedi Pranayama. So sun energy is helpful for your digestion. Mundukasana, frog pose, you put your thumb inside, close your hand. This is called Bala Mushti Mudra, or baby fist. Bring at the level of your belly button, and always remember, you are doing asana on your body signal, no pain. Effortless breathing, and breathe out first. Deep breath in, breathing out, slowly come down. And absolutely make no attempt. Let it come down on your own. Follow your breath and the pain. If you're here, it's fine. Stay here. Stay here between 5 to 10 breaths. If you can come down, it's okay. And then 5 to 10 breaths, you can get up. This is also very good for people with diabetes. And this literally massages your internal organ. And in yoga, you know, when you massage an organ, the organ function gets better. Then in your daily practice, you include the asanas called umbilical centering. I don't know that Hindi that much, but they call it maybe my Hindi speaking people will correct me, Pichuti Kichkaya or something, but umbilicus will be in center. So how do you test the center of the umbilicus? And when the umbilicus is centered, generally your digestive fire is very strong, igniting your Agni. So you lay down in your mat or a bed. Be sure your chin is a little down. Comfortably. Do some abdominal breathing. Breathing in, stomach is going to go high up. Breathing out, stomach will go, the abdominal wall will go in. That is a little tricky, but put your hand at the level of your belly button, umbilicus, and slowly push it down. Soon you'll be able to feel a pulsation. It's called a aortic pulsation. you'll be able to feel a pulse of your abdominal aorta. Here it is. Now I get it. So I'm at the level of the belly button. Another test is you can take a thread for a male from a belly button with your nipple line, and both sides will be equal. Many of the women, they do from the belly button to your collarbone, the middle end of the collarbone, or from the belly button to the tip of your red toes. You do these asanas to center the umbilicus, but also you do it for igniting your Jatha Agni. The abdominal breathing, or what you call a diaphragmatic breathing, is also parasympathetic activation, coming and cooling. The asanas for igniting your Agni, Jatha Agni. Number one, fit raising post or Utthita Padasana. Slowly raise your feet, but not all the way high up, around 30 to 45 degrees. Stay here for a while, and then slowly get up into a boat pose, Nokasana. Nokasana, will see initially will have a little bit of shakiness, but slowly it will come down. You will stay in every asana pose between 5 to 10 breaths, which you do in our practice, but because of this shortness of time and demonstration, I'm just showing you the asanas. Always remember, you do asanas where you are. It is non-competitive. There should be no pain, and your breath should be effortless. Remember, heart and lung is the same organ. You put effort in the heart with the physical posture, your breathing rate will high up, and there will be effort in breathing. Same way, if you do a little bit of a very faster bellows, Bhastrika Pranayama, you'll have the same issue, your heart rate will go higher. Third is your knee chest, Pavan Mukta Asana. Slowly bring your chin towards your knee, bring it in front of the knee. Again, stay here within 5 to 10 breaths. Then slowly roll on your side to side. Roll on the right side, left side. What a nice relaxation practice. Down. Three asanas. Feet raising, Padottanasana, boat pose, Nokasana, and knee chest, Pavanmuktasana. Bridge pose, Satubhan Sarvanga Asana. So remember, these are all, these are all focused in the belly button. Touch the back of your heel. Slowly raise your body high up. and go in one step at a time. Let's do the eyes closed. With the eyes closed, you can do it a lot better against your body. Once you're up there, see if you can bring your balance. Do it with the one-footed bridge. Other one. Beautiful. Awesome. Fifth one, patho-physiology, feet touching your forehead. Hold into one foot, bring it up, and slowly touch your forehead. Other side, now go to left foot, bring it up. I wish we have all the time so we can go along with you with the whole practice we do. We have to show it to you. Still, it takes a lot of time for the class. Slowly you can bring both the feet and bring it up and slowly bring it towards your forehead. Strong digestion, igniting your digestive fire. Yogic sit-ups is also another very nice. It does ignite the Jatharagni, digestive fire. It also massages the abdominal organs. You can slowly get up in a sit-ups, touch your toes, like a Paschim Uttanasana. This is also very good, sit and forward bend. Then comes yogic sit-ups. If you're practicing with me, try and you'll see the difference what yogic sit-up is. Yogic sit-up is hand behind your head. Just shifting your hand, it will go, oh my God, it's impossible to get up initially. One, try this, see. Igniting Jatharagni. Easy elimination, and these asanas you can do daily practice. This is a part of your regular daily routine. Easy elimination is called Shankha Prakshala. Shankha means a conch shell, And Shankha is also a metaphor for intestine. And Prakshalan is the cleansing. So cleansing of the intestine. Whole yogic concept is you wash your face, wash your eyes, wash your hair, wash your body. Why not wash your nose with a jalneti? Why don't you wash your stomach with a vaman dhoti? Washing your stomach. Or why don't you wash your colon with a bastrika? With a basti. And washing your small intestine with this Shankha Prakshala. So you keep on, you drink 2 glasses of water, you do 5 asanas. Nothing happens. You drink another 2 glasses of water, do another 5 asanas. And one of our radiologist friend, he has shown that during these asanas, there is a rapid transit of barium meal, showing is a proper elimination. This is called a full Shankha Prakshalan, a Purna Shankha Prakshalan, which generally we recommend about once a year. It's like almost like a Panchakarma, like it's a procedure, but can do without drinking water for a daily practice, as they call the Loghu. Means very low impact. Loghu Shankha Prakshala. There are 3 asanas standing up, 1 asana sitting down, and 1 asana laying down. Sitting down is your called Shankhasana, which is like a conch shell, and which is also called a Udar Karshanasana. Udar is your stomach, Karshan is a massage, it's massaging your stomach. And also, see, this is the beauty of this health tracker, that when you're practicing, you will be able to see your status of your marker. Okay. In fact, I'm getting a EKG now. I think there may not be a good contact between the underlying skin and my Apple Watch, because I see the recordings are not that good. Yes, it says poor recording. Anyway, we'll do that other time. Shankhasana, you sit down in a balasana, squatting pose. Take the right knee, put it in front of your left ankle, hold your left knee, push it towards the right side, breathe out first, take a deep breath in, and slowly twist your body all the way looking into the back. And again, stay here between 5 to 10 breaths, breathing out longer than breathing in. Very nice. To the opposite side, the left knee comes in front of your and push your right knee is in front, the left knee in front of your right foot, right knee pushing close to it. and turning your body. Shankar. It's a lot of external noise. Let me close the doors here. I don't know, you're not hearing, but I'm hearing the external noise. I'm sorry. It was a nice day outside. I had all my doors and windows are open, but I could hear a lot of external noise. You may not hear it, but I was hearing it. So, for proper elimination, strong digestion, easy elimination, proper elimination, first asana we show you was called a Shankasana. Next one is your Tirjak Bhujanga Asana. Oblique cobra pose. So for a cobra pose, you are in your mat for a cobra pose. Then separate your feet. In a regular cobra pose, you put your feet together. But in an oblique cobra pose, put your feet separated width of the mat. And you slowly get up in a cobra pose. And over the left shoulder, take a look at your right foot. Again, you get up slowly for a cobra pose. And look over your right shoulder towards your left foot. Other three are standing asanas. So let's see if you can get up from the ground without any support. Sit, rise, test. Okay, so here we are. Sitting down in the ground, no support, nothing. Ooh, very hard, not at all. Get up, please. Very, very important asana, which is your sign of health. First one, put your feet together, keep your spine straight. You may even go back to the wall. Be sure your body is absolutely spine is straight. Mountain pose, Tadasana. Patho-physiology. Take both the hands, go high up, and then you slowly can get up on your tippy toes and go high up. And stay here. It looks like what this asana has to do with proper elimination. That's what one of my gastroenterologist friend, he gave this yogi the barium meal, and they did extra studies and showing the barium is flowing very easily. Let's see if I can get. Tirjak Tadasana, oblique mountain pose. In fact, you can even hold your hand together this, or put your hand like this. Breathe out first, take a deep breath in, and slowly go on one side. Do this practice, regular practice this. So just want to tell you, we do the regular practice which covers all of our ailments. Tirjak Tadasana. Opposite side. Kadi Chakrasana, waist rotation asana. Separate your feet till the line of your shoulder. Put your hands in front. Breathe out first. Take a deep breath in and slowly turn your body all the way to the back. And within the same breathing out, you come back into the middle. Breathe in again. Breathe out, opposite side. You can also do Kati Chakrasana by putting left hand to the back, right hand over your left shoulder, and same yogic breathing. Breathe out first. Take a deep breath in and then breathe out. Turn to the opposite side. Right hand to the back, left hand over right shoulder. Breathe out first, deep breath in. These 5 asanas are for easy elimination. In fact, this is the sign of health in yoga. Strong digestion, easy elimination, and good night's sleep. Where did you get it from? You get it from looking at the babies. A healthy baby will eat, poop, and sleep. If they do anything else, they're not healthy. In pranayama, the primary pranayama is your extending the exhalation. So all of the breathing will be breathing out first, because lung is the balloon needs to be emptied, remove all the dirty air, and then slowly breathe in, and in time frame increase the timing, but be sure it's effortless. And the breathing out will be your longer. And that will be your regular breathing. In fact, you will develop the neuroplasticity, so you will be able to breathe like that in a involuntary autonomic setup, like when you are sleeping, which will be functioning of your brain stem. The Kapalbhati pranayama, a slow Bhastrika pranayama is also very effective. Alternate nostril breathing, Anulom Vilom pranayam, your Nadi Shuddhi pranayam, breath holding in alternate nostril breathing, very effective. Our Brahmri pranayam, bumblebee breathing. Our chanting Om pranayam, Pranabo pranayam. So if you're all interested about a detailed pranayama practice, you can go, I think it's the beginning of this year, we did a session how to start a pranayama practice. That will be in our YouTube channel, and almost all of you have my YouTube channel link. If not, just give me a message and give it to you. Sit down in the Padmasana lotus position. We do the Kapalbhati pranayama in a 5 or almost 10 mudras. Touch your index finger and thumb. This is your Jnana mudra or Dhyana mudra. This quiets down your mind. Index finger down is your Vayu mudra. It quiets down your Vata axis, and also it cuts down your pain. Pain is responsible for Vata. Middle finger and thumb is your Shunya mudra, or a mudra of emptiness. It improves your hearing. Touch your ring finger and thumb, Prithvi mudra. It improves your kapha imbalance, good for diabetes, truncal obesity. Little finger and thumb is a Varun mudra. Varun mudra is for your body fluid, improving bladder function. Little finger, ring finger and thumb, Shakti mudra. Prana mudra, this improves your strength. Middle finger, ring finger and thumb, is your Apna Mudra, called a Pachan Mudra, digestion Mudra. Index finger down, Apna Vayu Mudra. It helps your cardiopulmonary function. You can touch the other two fingers. Udana Mudra, the three fingers, Vayana Mudra, Linga Mudra, which helps removing your phlegma, Ganesh Mudra, remover of obstacle. Regular practice, we generally do about 50 Kapalbhati Pranayama with each mudra. So 10 mudras, it becomes 500. So start with, I'm not going to show you the whole thing, just to show you how. There is a balloon, there's a diaphragm, there's a balloon, which is the abdominal cavity with all the contents inside, and then separates the diaphragm, another balloon in the top, which is the lung. Bring your awareness to belly button, push the belly button in, it will hit all the internal organs, it will hit the diaphragm, hit the lung, all the air will come out. Active exhalation without inhalation. Inhalation is passive, you'll be inhaling in between without knowing. Spine straight, eyes closed, 1 per second. If you're new to your practice, you can put your hand in the abdomen, you can see this going in, and then you can feel the air is coming out. I'm not doing any breathing in, I'm not even paying attention to my breath. My focus is here. But I'm breathing in subconsciously. A lot of people say, I cannot do this. Our approach is, can you cough? Give me a cough. Okay? Can you cough with your mouth closed? Mouth is closed, cough down. Becomes a Kapalbhati Pranayama. It massages all the internal organs, it massages your liver, your stomach, your spleen, your colon, small intestine. For women, it massages your uterus, tubes, ovaries, bladder. For the men, prostate. Massaging of all the organs helps. Very effective for irritable bowel syndrome. Keep doing it, you'll feel the difference. After these asanas, Vajrasana, Mundukasana, and the igniting Jataragni and proper elimination. Uddiyani Bandh. This is called your abdominal lock, and also your root lock, Mula Bandh. Mula Bandh is sitting down, you breathe out first, take a deep breath in, breathe out completely, then hold your breath and pull your anal sphincter, anal canal, pelvic floor all the way high up and hold it. It's amazing is how it improves your anal sphincter function and how it aligns your rectum and anal canal. Same like sitting in a Malasana, which helps in irritable bowel syndrome. So abdominal lock, same way. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. And as you know, during pranayama practice, get a little cough is entirely normal. That means your air is going to the right track. The air is going through your larynx, through your trachea to the lung, because the cough comes from your larynx. And this air going over larynx just irritates your larynx a little bit, bringing the cough. Agni Kriya, doing the same, stomach sucking in and the massaging. And the massaging with your massaging the whole abdominal contents with your abdominal wall. Same as the Nauli. In the Nauli, you take your rectus muscle, isolate your rectus muscle, and move your rectus muscle side to side to massage your abdominal cavity. Breathe out first. Deep breath in. Completely breathe out. Agni Kriya. Very, very important for irritable bowel syndrome and restoring the gastrointestinal function. As you noticed that the attack of irritable bowel syndrome with a sudden severe abdominal pain, with a lot of gastrointestinal symptoms, gas in the stomach, explosive diarrhea with the drainage of the mucus. These are all due to your sympathetic overdrive and stress. And as you all know, the root cause is your insomnia and sleep apnea. So let's see how the yogic sleep, which is a sign also of health, a sign for irritable bowel syndrome, helping. You'll see the two people are asleep very well. One is your babies, the terms sleep like a baby, and the yogis. In fact, yogis don't sleep much because sleep has two components: REM sleep and non-REM sleep. REM sleep called rapid eye movement sleep. Non-REM is your non-rapid eye movement sleep. REM sleep is your time when your mind is still active. And it's almost 25% of the sleep, and your cycle varies from REM to non-REM. Non-REM sleep is a real sleep you need, which has 4 stages, and first 1 and 2 stages are very mild sleep, and 3 or 4 is a deeper sleep. So if you think about 6 hours of sleep, you will have a REM sleep about 90 minutes, hour and a half, and non-REM sleep about 4.5 hours. So half of your 4.5 hours is, like I said, 2 hours and 15 minutes. That's a deep sleep, and that is a sleep you need, because that's the time all the repair in your body and mind takes place. So for a sleep, people say, how long I'm going to sleep? Sleep is not a quantity, it's a quality. That's why all the health trackers today now have a marker for your deep sleep. They'll tell you you slept 6 hours, but your deep sleep only 1 hour. Or you sleep for about 4 hours, your deep sleep was 2 hours. That's the deep sleep which you need. For yogis, generally stays in stage 1 and stage 2, sleep all the time because of their meditative practice. So they only need your stage 3 and stage 4 sleep. I have seen yogis and rishis sleeping only 2-3 hours a night. Sleep like a baby. If you see a baby, baby will sleep with the asana called Supto Baddha Konasana. They'll put their feet together, and this is the way a baby sleeps. Take a look at a baby, that will be their sleeping posture. So people with insomnia, we teach them sleeping. People say they have a discomfort here, so put a little folded towel or a pillow and slowly remove it, so you will not have any issue at all. First, you do some abdominal breathing, because abdominal breathing is very calming, cooling, relaxing, and parasympathetic. Breathe out first. Abdominal wall goes in. Breathe in. Abdominal wall will raise higher. And breathe out. And when you see a baby sleeping, it's the same thing. Baby's stomach will go, abdominal wall will go high up, abdominal wall will come down. We practice same thing, going to the bed every single night, and do it about 15 to 20 times. Then incorporate breath holding, and simplest breath holding is twice the breath, inhalation, and practice about, again, 5 to 10 times. Exhalation longer than inhalation. So the practice will breathe out first. Breathe in with a count of 5 in. Breath hold with a count of 10. Breathe in with a count of 5. Breath hold with a count of 10. yogis sleep on the left side for the time, but initially they sleep on the right side and in a fetal position. Yogis don't need a pillow. If you need a pillow, it's fine with you. So, in the right side, you can put your both the hands and put your head on the hands on a during sleep, body core temperature comes down. And all the muscles get relaxed. Initially, body core temperature is high. Sleeping on the right side, it opens the left nostril. Left nostril is moon energy, Chandravedi pranayama, it's a cooling. This is going to cool your body. After little time, when this deep sleep comes in, you can turn on the left side, you can put your head down, hands, or you can take a, let me see if we can get a small pillow. This is the way yoga sleeps, and we also sleep same way. Also use a very relaxing asana, which babies do all the time, called baby fist, Balu Mushti Mudra, thumb inside and close, and just put it next to you. You'll have a wonderful sleep. As they say, it will be money back guarantee. Once you have a good sleep like this, with a deep sleep, it will do all the repair, and irritable bowel syndrome will say, this is not the body, I need to stay. And slowly you get up, and one very important thing is, if you know what is triggering your symptom, because this is a sudden acute attack, you will be able to modify your lifestyle with that. The triggering. Triggering is the food, triggering activities, triggering the stress. Medication wise, there's a bunch of medications in the market for irritable bowel syndrome, which only thing we recommend that before going to bed at night, you use little bulk laxative, which is a fiber, psyllium, which is in the market named Metamucil, but don't put it down for too long in the water, then it will absorb the water. Put it down for a short time, then take it throughout the whole night, it will absorb the water and slowly will pass through the whole gastrointestinal tract. It's a wonderful practice for irritable bowel syndrome, and if you have any question, if you have any comments, please put it down and I'll be glad to answer for you. Please send me a note. What is the next condition or ailment you want me to talk about? And as you noticed, that when you go and see our daily practices, we have incorporated all these in our daily practices. So when you do the daily practice, what you do, you cover all the ailments, all the chronic dis-ease. Thank you for joining. And again, my last line is, if I'm in town, I will be here with you. Only time when I'm out of town or I have other presentations. One of the Saturdays I have a local presentation, so I may not be here on that day, but I'll let you know via Facebook. Thank you for joining. See you next Saturday.